So welcome everybody. We are here for a webinar on chapter 4 of the book on using evidence in policy and practice, lessons from Africa. And chapter 4 looks particularly at how performance culture affects the public service and affects the use of monitoring and evaluation. And we got a very distinguished lineup. Unfortunately, the chair has not made it. We're not quite sure what's happened. We hope he'll be able to join us in a few minutes. The chair is actually meant to be Dr. Abrampa Mensah, who's the director of the National Development Planning Commission in Ghana. He must have had a problem. And what he was going to give some sort of introduction to the sort of how this is relevant to Ghana, and I'll skip that and hope that he's able to do that later. We have a distinguished lineup of speakers. So first of all, we have Kara Walla, who's the program manager of Twende Mbele, the program of African governments supporting M&E. And Kara is one of a group of people who were co-authors on this chapter. She will give an introduction to the research and also the framework, and then give some substantive presentations from what came out in that particular chapter around performance culture in the 3 countries of Benin, Uganda, and South Africa. And Stanley Ntukumba, who's also one of the lead authors in that chapter and comes from the Department of Planning, Monitoring and Evaluation in South Africa. He will try and relate this to the experience of trying to manage COVID and what are some of the lessons about how performance culture actually affected that response and affected monitoring and evaluation in this time. We'll then have around about 40 to 45 minutes of questions and answers, which will be moderated by Mine Pabari, who's one of the co-editors on the book. And lastly, we'll ask 2 people to respond and give their inputs, their reflections on what they heard, their reflections from their country, just brief inputs, and also from what you've come up with in the question and answer. So first of all, we're going to ask Damas Sosu, who's from the BEPAG, which is the Office for the Evaluation of Public Policies and General Actions in Benin, to give his reflections. And second, we'll ask David Kiboy, who was formerly running the National M&E unit within the Ministry of Finance and Planning, but is now actually within the public service section within that same ministry. And we'll ask him to give his reflections from a Kenyan perspective. So with that, on the assumption that we don't yet have Dr. Abrampa with us, I'm going to ask Kara Walla to start off with some, the framework and some what came out of the chapter.
Okay. So yeah, as Ian said, I am one of 6 authors on the chapter 4 in the book, entitled Mere Compliance or Learning. And it's looking at M&E culture in 3 countries in the public service. For those of you who haven't been to one of the many webinars on the book yet, this was a research project trying to look at practical examples on using evidence for policy and practice. And there are 39 co-authors. Even though Ian and Mine are the editors, there's quite a wide variety of case studies on using evidence in policy and practice. So there's 8 cases from 6 countries. From our side in Twende Mbele, we have most of our countries represented within those case studies. The book also explores the use of different types of evidence, so looking across both evaluations to research, rapid synthesis, etc. And what we're trying to do here today, and what comes out quite strongly, we hope, in the book is, what are the things that supported evidence use to happen? So for us today, we're going to be looking at some of the contextual side of those things. But obviously there are other things. So there's a link to the book if anyone wants to read it. You can buy it or you can get it for free. I understand the book is currently being translated into French. So for the Francophones out there, it's coming. So most of the chapters in the book are trying to relate to this analytical framework or theory of change. And it's trying to understand, how do we get, I guess, this end result of evidence use and eventually development impact, but by starting with the demand for evidence. So the analytical framework here doesn't start with supply, it's looking at demand. So who are the institutions and the people and the systems in government and others who are demanding that evidence? So then we can perhaps generate it and supply it, as it were, then use interventions that Twende, Clear, other organizations might be putting in, for example, capacity building, building champions and mentors. And then hopefully we add to that some change mechanisms around awareness and access and other examples there, to get some changes at the individual, organizational and systems level around the motivation to use evidence, the capability to use evidence and the opportunity. And then in a magical pot of beautifulness, we end up with people using evidence. So individuals, organizations, and systems are changing their behavior. And we conceptualize that somehow as both also instrumental, conceptual, symbolic, and process use. So there's different ways that evidence can be used. It's not only one way. So around all of that, we also have this big scary thing called context. So within the context, we want to look at the macro. What are the big political, economic factors that are feeding in? What are the relationships between state and non-state actors? And then internally within context, we're looking at organizational culture, the capacity within the organization, management and processes, and other resources, so around budgets and all that sort of thing. So for us, we assume, as I just mentioned, that culture is part of the context, and that all organizations have a culture. For us, we want to be looking for a learning or evidence culture, an evaluative culture, some people call it. As you can see on the right, John Main was a big sort of theorist about this, and I understand he's recently passed, so it's nice to just take a moment to be aware of the contribution he's made to this idea. But he says around evaluative culture is one where people are deliberately seeking out information to learn and improve their either programs or policies, services, etc. So that's kind of what we were looking for in the public sector across Benin, Ghana, and South Africa. So for us, we sort of thought of monitoring culture often linked to compliance, whereas evaluation is to learning. And so we wanted to know, where is the focus of that? Sort of, is it a monitoring or is it an evaluation culture? Is it compliance? How does it look within these three countries? So we did a baseline survey. As I mentioned, the purpose was to get a hint as to the state of performance monitoring and evaluation culture within the public sector of Benin, South Africa, and Uganda. We used a closed questionnaire across 22 national departments and ministries. We did the baseline in 2017 and plan to do another follow-up survey, perhaps either this year or next year, depending on budgets. We went to about 5 departments in each country, which equaled around about 368 respondents, 46% of whom were senior managers. So we wanted to get the opinions of those perhaps in more decision-making or positions of authority. So some of the key messages from the baseline were that the findings are relatively consistent across countries. So despite differences in the political context, be it around the presidential position on use of evidence or how democracy is functioning, the use of evidence, the barriers and facilitators to evidence use were very similar. So 61% across the 3 countries say that they use evidence, evaluation evidence, often or always, to make decisions. But that also another question, they say that 40, 49 and 50% rarely or never use evaluation evidence. So there's a bit of a glass half empty and a glass half full in terms of 61% is quite good, but then it could also be a bit low depending on where you are thinking, where you're trying to benchmark. And this evidence use is driven by both demand and supply issues. And some of, as I mentioned, the barriers and facilitators, there's a mix of both system and cultural inhibitors to use, and we'll go through those in a minute. But overall, the culture in the 3 countries does seem to be more compliance driven, with elements of learning and transparency for improvement evident, but perhaps emerging rather than embedded. So we looked at different dimensions of context with this survey. And what I want to focus on here is the internal part of that context, and that being the culture. So looking at the attitudes of public sector officials to success, to failure, to learning, what institutional incentives are there, and when is evidence used. So in summary, there is a high demand from ministers for evidence use. About half of managers are supporting of using evidence, but around half also do not use problems for learning. So there was a question around, are problems seen as opportunities for learning? And about half of people said yes, half said no. So oftentimes the historical evidence is used more than real time. This was about saying, do you use along the evaluation cycle, are you using the information at all points or just when it's finished? So this was saying just when it's finished, or perhaps things that were from years before. So as I mentioned, the cultures within the public sectors are still largely compliance driven, and there are challenges with management's attitudes, especially around a fear of admitting mistakes, some things around transparency, the hierarchy limiting people, and some issues with being able to take risks and to learn. So what are some of the things that we found facilitated evidence use? Political will at the top of the state and the institutionalization of evaluation. So for all 3 countries, the Monitoring and Evaluation Department is housed either in the office of the President or the Prime Minister. And this gave a lot of kudos and a lot of influence to the Monitoring and Evaluation Department and facilitated the use of evidence. The existence of institutional incentives around linking performance expectations with individual performance agreements, using performance information to learn and change, rewarding or recognizing good or poor performance, and sanctioning of poor performance. So these things happened to varying degrees in the different countries. So I think Uganda was quite good at rewarding and recognizing good performance and also sanctioning poor performance. And it would be interesting to see the interplay between those with then not just performance, but planning with M&Es and budget. So improvement action plans for South Africa and Uganda were seen as a very big facilitator for using evidence, and Benin was in the process of preparing their own. Damas can update us on how that's going. Some of the things that inhibited culture were around management not promoting evidence use. So again, 30 to 50% of people said that managers do not promote evidence-based policy or the effective use of evidence. a third of respondents indicated that findings from evaluation are often concealed, that there is resistance from senior managers to use evaluation findings, and that there is little respect for evidence within the decision-making processes. 40% indicated that the hierarchy makes it difficult to honestly discuss performance. And then there's this sort of emerging culture, or quite, it's not emerging, but there's sort of indications of a command and control culture. So 50% of people say that their managers fear admitting mistakes. About 40% see M&E as a way of policing and controlling. And again, 40 to 46% indicate that problems are not treated as an opportunity for learning and improvement. Additionally, another inhibitor was this time pressure. So over 40% of people indicated that time pressure meant that decisions are taken without a proper diagnosis of the problem. So again, a lack of use of evidence and a lack of time to kind of do the best policy and planning that people are looking to do. So I'm not going to talk a lot on these. It's just a nice table to present some of the differences across the countries. So again, where we say managers fear admitting mistakes, we can see that's quite a bit higher in South Africa. But perhaps, the influence of M&E can be seen to be quite consistent across other countries. So these are the cultural barriers. So as I mentioned, we broke it into system and cultural. So these cultural ones are sort of around attitudes and values presented by management or the department more generally than individuals. And then we had the system barriers. So this is around time, this is around capacity, this is around how conclusions on policy effectiveness are given and framed, which was actually quite a big one. And then of course, financial resources are always a big problem, never enough. So in conclusion, I think what we saw was, despite the consistency across countries, there is a bit of a mixed picture around the demand and use of M&E evidence from ministers and senior managers. So in one, on one hand, a third of cases of findings are concealed, and around 40% perceive senior management to not be championing honesty about performance. But we do also see that 60% then are. So it's a bit of a glass half full, half empty situation, as we saw before. But overall, we felt that these results do not create a great environment for learning. M&E is not seen as particularly influential. And so clearly a substantial proportion of people are feeling that management is using M&E, and oftentimes we actually didn't break up M and E, so it could be both or one. But they are using evaluations after they're completed. So the implications of this is that, government systems across the world are often command and control driven. Hierarchy and bureaucracy are a big problem across the globe, and we're no different here. And that changing from a sort of traditional bureaucratic culture towards a learning and evaluative culture can take a really long time, despite both system changes and procedural changes. And these systems and values are situated within, these systems and these values both inhibit and foster different types of cultures. So one of the big questions that we have for Twende is, how do we get managers to stop fearing making mistakes? And we glossed over it, but given that oftentimes the linking to performance management and the reward and the sanctioning systems are not very strong, and how do we get a balance around improving the influence of M&E units within the whole M&E system, while moving M&E away from being the sole responsibility of the M&E unit? And I think this is especially important in times of crisis, when government needs to not be working in siloed ways, and they need to be communicating at a really fast pace about what's being found and making sure that that evidence is influential. So that's the end. Thank you very much.
So thanks, Cara. So we're not going to take questions now, but you can obviously put questions into the chat as we're going. We're going to move straight on to Stanley Ntakumba, who's from the Department of Planning, Monitoring and Evaluation, to reflect on how this culture is affecting government in this time of crisis. So Stanley, over to you.
Thank you, Ian, and good afternoon to the participants in this meeting and the fellow presenters. Yes, we thought of this type of a response mainly as a reflection based on where we are at the moment. So as you will see, my questions are more like a case study and less about the real analysis of other evidence out there. Maybe let me show my face as well.
Yeah.
For a short while. All right, thank you. I don't know if slides are moving. Are they moving?
I think we have the chair has arrived. So
yes, finally, serious technical problem, but I'm here.
Great, good. So just to brief you, I didn't do any particular introduction except I introduced the speakers. We've had the first presentation by Cara Walla, and Stanley's about to start the second presentation. And with that, I'm going to hand over to you.
Thank you.
Ian, must I continue or wait for the doctor?
Yes, Stanley, thank you very much. You should continue so that we don't waste the time. Sorry for joining a technical problem. You're welcome, Stanley.
Thank you very much. So basically, we'll be drawing implications on from COVID-19 linked to the presentation of the chapter that Cara has just summarized. We do know the numbers. We do know COVID-19. I picked up on just a few areas, the more common areas where the public sector response is mainly emphasized. The first one is around the declarations of state of emergency. In other places like South Africa, they are called state of disaster. The big question of containment of the spread through lockdowns and their impacts. Then the socio-economic interventions through fiscal and economic relief measures for vulnerable groups, as well as partnerships. So on this area of state of emergency or state of disaster, we're talking here about the issue of mere compliance versus learning. Emergency situation by its design requires new ways of working, and the tendency is for compliance to be mandatory on some of the basic necessities. It's like if it's a house is burning, so somehow there is less explanation and less need to draw from kind of negotiated space. And now in this case, some of the basic things like sanitizing, quite clear in our case. I mean, a simple example is, what does it mean for an unemployed person who doesn't really have food to be under lockdown? So they quickly jump out to the street and look for a job to survive. And in a way, those are some of the realities. Then you can actually escalate that principle to other areas of life. Of course, the issue of rise of legal contestation and the regulatory regime. It's a paradox of exercising rights in a democracy, as well as the respecting the rule of law. And that tension has led to a lot of court cases as well in the context of South Africa. And I can see contestations still continue in other jurisdictions. The need for governmental intervention to cushion livelihoods and sectors that are adversely affected. So as I mentioned then, government also expected not just to respond to the crisis of a pandemic, but to cushion livelihoods. So what for M&E culture, though I won't necessarily draw a very direct link or causal link here, there was a need to readjust our M&E systems and budget to respond to COVID-19. In some cases, the situation is a bit not so in favor of M&E, because then the budget is cut in favor of maybe distribution of food parcels. Primarily a health sector problem, as we all know, but given the situation, it then affects everyone. So we've got to then balance that. So it's a wait and see issue for people who are outside of the health sector, and suddenly realize that actually this is not about health sector. You've got to continue monitoring the areas of your own sector as well, cross-cutting spaces like public sector broadly. Then the second area of containment of the spread, normally summarized with the cliche of flattening the curve, has its own implications as well, linked to the first one. Lack of movement within countries and borders, still quite prevalent, as you know, and focus on only essential services, mainly frontline staff and those who have made to make decisions. And on M&E, for example, the whole limitation of face-to-face interaction in the workplace affected our traditional tools of trade. We use quite a lot of meetings, workshops, which need people to interact in a particular way. We use a lot of training that would be physical, and even site visits for verification and those kinds of things, or data collection for evaluations. And all of those traditional tools of trade got disrupted, because you wouldn't necessarily then do the things the way you would normally do. And the more subtle aspect, which actually is the most important, is the psychological impact, or social psychological impact that it had on everyone, because suddenly you're all paralyzed, what to do and not to do, and trying to understand the steps that are being publicized and the rules that are being set, and so a degree of immobility and the fear that goes with that. So implications for M&E, firstly, the reality is that we've got to always maintain our results focus if we have to champion the learning culture. So choose strategic issues to monitor. So the tendency sometimes is to see quite a lot of data being thrown around, and every other person doing their own tracking, like in epidemiology, it became a more prominent field, and somehow then many practitioners suddenly don't necessarily see how to think outside of that box. It's almost like the first light that I showed here. So it becomes the mantra for everyone, and this is epidemiology, and M&E could add value rather than just describing or listing these type of figures. So the real-time data to understand a fast-moving crisis became a biggest challenge. So drawing from tools like modeling and all of that, but I think in some cases the reality is that capacity was very limited on the M&E unit side to be able to really keep up with the kind of questions that the crisis is still there, is raising. And of course, the demand for rapid evaluation using innovative methodologies like online tools. So there was that shift, and of course, it's a culture that isn't yet fully embraced in the evaluation community. But that became really an instrument that one could use more effectively to answer some of the questions using more deeper type of in-depth tools like evaluations and research. Now, on the area of livelihood, the social relief measures, we do know then that rich countries were able to move quickly to then have that rule of thumb, 10% of GDP, and even more global or let's say regional bodies like the EU's were able then to provide the economic relief packages for that. Some developing countries, in South Africa, we tried our 10% as well, but not necessarily sustainable given our fiscal constraints and the economies that are performing quite poorly. Now, here, the issue then for me is how do we as M&E position ourselves? These are traditional issues of monitoring policy work on social and economic policy or public policy broadly. So the reach becomes important. Are these packages reaching the right people? So you might have had contestations around questions of corruption, lack of transparency, and all of that in many jurisdictions, inclusive of ours, inefficiencies in how things are done, for example, double dipping on databases because they are not linked. So you come with reports like Auditor General then showing those type of things where actually this could have been done with a much more better way rather than maybe buying a new expensive system that rather than using what could have been more simple and effective. So those are traditional M&E questions. Are you effective? Do you achieve the objective that you set yourself? Why? Why are things the way they are? Impact as well, attribution and contribution. So those are some of the things that are still preoccupying us, and I challenge colleagues to also continue designing evaluations that could answer those type of questions around the socio-economic impact side. So what are we learning then to improve future policy responses? So my observation is that there is demand for evidence, and there is a very limited supply, and some of that constraint comes because of the pace. The pace is too fast. I mean, a good evaluation usually takes about at least 4 months to about a year, but in this case, you're expected to produce an evaluation in a fortnight with limited resources, and as a practitioner, you're really fearful to answer questions with partial weak type of designed type of studies or evaluations. So there needs to be some ways in which we create those mechanisms to make this demand. The last point is around partnerships between the public sector, business, civil society, labor, as well as new issues that are emerging in the society, and call those political economy issues. Firstly, clearly collaboration and multi-stakeholder consultation, partnerships are really no longer just an option. It's something that the crisis has shown that it's a necessity. You must engage others, otherwise you won't move too far. We have innovative things, like an example here would be these solidarity funding models. You have it in South Africa, you have in the African Union, at the WHO, in many other countries where it's a basket where even individuals contribute their own maybe salary or whatever resources they could, and as well as in the distribution of social relief packages like food parcels. See quite a lot of work being done there by community-based organizations, religious communities, and even the traditional large NGOs, Gift of the Givers, and so on and so forth. So that is something to take home that we need to observe. I'm raising these new difficult questions. They are necessarily in the context where we operate, not necessarily issues of M&E. So in our context, then, the moment then you started regulating things like religion and culture, so you find a high rate of contestations. I mean, there are very big restrictions around gatherings, for example. So churches and mosques and synagogues, in that we are affected as burial rights, different ways people will practice that. The question now in the global domain, the whole notion of vaccine nationalism, that's a political economy issue because of the inequality that comes with this, what we see now, where there are countries that literally don't have and are not likely to have these vaccines in the near future, whilst others are actually, going to be above 50% of vaccination soon. The biggest challenge here in the evidence space is the whole notion of fake news and myths. Now, it's a debate around the disinformation in the post-truth era. And what does it mean in terms of trusting evidence and how evidence should be presented? So we operate in that space. And what is the new normal? Because it's a cliche that also is kind of peddled around. And so where do you put the line and say, this is where we are now? So there is a reconstruction quite clear in the economic side, But when the crisis is still on, the questions of what do you mean by post-COVID world, when COVID is still affecting us. So those are some of the issues. They are not just about words, but a real understanding of our context, and at least agreeing to come at least from the same page about where we are and where we are going. And of course, concerns that the public sector health systems are stretched, and the focus then became almost exclusively on this pandemic of coronavirus.
Parce que tout est centré maintenant sur la pandémie du corona et aussi
In the West Africa. So in a way, how do you then sustain the effort that has been already achieved, or baselines or foundations that have been set in that space? Now, from M&E implications, see these more as questions really, because it's an area that is more contested. So my view is that we do need to strengthen evidence ecosystems to ensure their resilience, and then develop incentives for evidence use. So in a way, we cannot necessarily just put monitoring evaluation alone. It has to link up with the whole evidence ecosystems, the different types of research and other instruments that are there, and be able then to contribute to resilience in future. Then learning culture using evaluations and research, very important that we champion that. And then of course, these questions, they require us to engage in a way that seeks to take us forward. Then in conclusion, as a summary then linked to those big themes that Kara spoke to, on the macro context, one, the COVID-19 situation is a global phenomenon, so no one is left behind. So I think that we all know. So what then does it mean for us in terms of operating in silos, either as different sectors or different countries, and given that this situation needs a kind of a joint effort across the board. So we've got to engage with that context. So the good old silo of my unit or my ministry or what is no longer that effective in reaching this. So M&E units have to engage with that reality. Public sector capacity is stretched to the limit, and leadership is critical. That's quite obvious. Then the intra-institutional linkages aspect. Of course, we do need to map those M&A ecosystems, have multi-sector partnership. Now, for learning to happen, you do need a lot of capacity development as well. So these capacity development and even donor partnerships are more important than ever before, because in a way, the debates were in a certain space before the onset of this crisis, and I don't know, maybe the development partnership space has moved in a way. For example, the whole compliance issue, we are championing as M&E practitioners, even through facilities like Twendembele, saying, now you need to use M&E practitioners to distinguish themselves from other practitioners like auditors and even law enforcement, to be more about learning culture, championing use of evidence more in a nuanced way that seeks to answer deeper questions of why things are the way they are, implementation, how to move things forward. So where we are now, we are actually back in a hardcore compliance culture. There is a need for it, but there is also big unintended consequences. So the internal culture then within the organizations like ours, and then we've got to deal with the implications, especially the high visibility of, law enforcement. When we did the similar survey in South Africa in 2012, one of the interesting responses on an open-ended question was people saw M&E practitioners as police. Quite a good number. It's just that I forgot the number. Ian might still remember. So M&E as policing. And that was a bit of a challenge for us, that really there's too much compliance-driven culture, then it makes M&E not to really add value in the eyes of some people. It creates an expectation that if you are doing an evaluation, everybody must be fearful because you are there either like someone who wants to arrest them and punish them in a way. So we have to deal with the unintended consequences of the fact that when this chapter was written, we were already complaining about that culture, and now we need to find a ways of regaining the ground around learning and broader use of evidence. Of course, there is absence of resources for evaluation, and there is limited learning culture. Now here, the Learn As You Go is actually on the training side of M&A capacity development. Opportunities are limited to do the traditional training as you would normally do, so it's more online. But the bulk of it is really you have to learn on your boats, and that has its own advantages and disadvantages, because to be where you are as an evaluator, you've gone through certain phases of your life, inclusive of being exposed to hardcore basic training that you require. But in this phase, some of those luxuries are not necessarily available. And the last 19 situation, and given that we wanted to stimulate demand, it is a positive development. So therefore, as M&A practitioners, we should also rise to the occasion. I'm impressed by the science community broadly. For example, this whole discovery of what is the strain now that is there and all of that. That's research. So with M&E, there are certain things as well that we could do that should really entrench a better reception and impact of the work of this set of professionals. Thank you. Thank you, Chair.
Thank you very much, Stanley, for this brilliant introduction to this very important discussion. I mean, it's so obvious that the COVID has really revealed the importance of M&E in our lives as development practitioners, and particularly for us in Africa. It's also bringing a challenge to us for our public sector, and the skill and the knowledge that is required to pursue M&E, and in a very fast mode during this time. We realize that if there's any contribution to resolving this COVID, it's becoming obvious that learning is key, evidence is primary, and also data management is quite essential for us to deal with it, which you have also brought to fore. You've also brought to us the issue of partnership and joint activities, not only across the continent, but even global, but even within our area. To what extent are we making use of this partnership and joint relations, even mobilizing funding and resources to be able to respond to this? This is very important, and even strengthen our M&E processes in terms of evidence, in terms of data sharing, and even coming out with outputs and outcomes which we can relate and compare as countries. These are vital things which you have revealed to us, and I think that the importance and the essential nature of this cannot be underestimated in any way and overestimated in any way. Thank you, Stanley. Thank you. Great.
Thank you.
I can see questions popping up already, and that is very interesting. So we would call on, I think this has to be moderated from our end in order to make sure that everybody's question is picked, and those that are repeated are also compared. And we should also know that we are also doing it across languages, both French and English, and therefore this is very highly invited. Okay, I think we'll have time for questions and answers now, and this will be moderated by mine. So I will just invite mine to moderate the process for us. And given our time, I think we should be able to do this within 30 to 40 minutes, but we don't mind. If there are more questions, this is the beef of the whole process. That's it. So mine.
Thank you, Chair. Hi, everyone. I'm Mine Pabari, and I have the pleasure to moderate this session. I'm going to start off with a group of questions around culture. It seemed like quite a few questions have started coming through around the culture and the use of evidence, and particularly around the learning culture. And I'd like to kind of invite not only the speakers, Cara and Stanley, to respond to this, but perhaps also, and you'll forgive me, Ian and the chair as well, Dr. Mensah, if you don't mind, perhaps you may have some thoughts on this, given your experiences, particularly with government. Thank you.
Good.
So the first couple of questions are related to, they come from Cara's presentation around culture being command and control, and really the realities that change is not easy to come by. And linked to that is, really, do we have any experiences or thoughts around how we might better encourage the use of problems for learning? Again, linked to the compliance culture or a much stronger interest in rewarding and sanctioning performance. And there's a third question that's linked to that. I think this comes from Dugan. Yes, welcome, Dugan. And that the question is, well, how do we, well, it's more of a statement as well. We need to make better use of compliance and stop treating it as a problem. The fact that people comply is an asset, not a liability. And we need to sophisticate our instruction and optimize the desire of ordinary people to comply so that compliance delivers the intended learning results. So open to you. Do you have any thoughts around the organizational culture issues linked to compliance and how we might better overcome them or even use that culture as suggested by Dugan? Perhaps we could start with the chair.
Yes.
Excuse me, it's quiet. Are we expected to respond now?
Yes, please.
Yes, Stanley, if you can give a response, yes.
Thank you. Thanks, Amine, for that summary. On this question of compliance not a problem, I agree, because even as M&E people, we design templates, rules, and guidelines for purposes of just ensuring that there is compliance. But it's a challenge when it's just about mere compliance. So I've ticked the box, then I sit back. That's the culture that we are trying to overcome. Because then that's the one that brings too much or over-regulation, as if then people will operate as robots. They can't think for themselves. So when an evaluation, for example, is done, as an evaluator would recall, then you normally then would come with ideas that even challenge how things are done, how systems are designed, and make those recommendations. So in a big bureaucracy, what is highly regulated and highly compliance driven, just engaging with a recommendation of an evaluation is not such a simple thing. It's not an easy thing, because then everything is seen from, no, actually this is the rule of 1940. You can't just wake up and change. So in a way, then evaluations and research in particular, or even recommendations of broader M&E, then don't find better usage in an environment that is about mere compliance in a robotic way. But otherwise, I fully agree with the principle that if rules are good, and just like driving on the road, so complying is also good. But if then it's not, it's just about mere compliance is bad. Now, Khototso, you raised the issue of the PSC. Public Service Commission is an independent body in South Africa that oversees the work of government or public service, especially on the human resources side of things. So over time, it has also realized that it's got to emphasize what in our constitution is chapter 10, values of the public service, like developmental orientation, professional ethics, and so on, from a point of view of value-driven culture, not a tick box. Now, I'll use an example in a hospital environment where you would have clear supply chain rules that are set up. and then there is a potential death that is going to happen, and someone who is around the corner, maybe just a supervisor, can actually find a solution, maybe for whatever solution is required to make sure that that life is saved. But in a mere compliance culture and a lack of values-driven approach, you'd rather say, I won't break the rule because I must comply, rather than saving a life. So this is the debate, really. And your question is then, how are we working with the Public Service Commission? Yes, it's playing that lead role, championing that. We do work with them, especially from a perspective of some of my work on the championing the capable, ethical, and developmental state, to then say we've got to change how these things are done. And even on the fight against corruption, if you don't champion a value-driven culture, you suffer a lot because people can show how they've ticked all the boxes, but they were doing the wrong thing instead of the right thing. So that's where this then a value-driven culture backed up by strong evidence use becomes very crucial. So that's what we are championing, then, to say let's shift the pendulum whilst we respect the importance of the rule of law. You should actually change behaviors. And how then, for example, in the COVID-19 space, it has to be mandatory, and there is a six-month sentence for not wearing a mask. So that emanates from lack of behavioral change and the culture that says if it's not in the rules, or I should hide from police, then I won't do it, rather than saying, actually, this is a good thing to do because it's a right thing to do. So that's where M&E would really bring a lot of value by really helping with influencing behaviors and actually informing results that take us forward to the type of objectives and goals that we have set for ourselves in developmental sense. Thank you.
Thank you. Thank you. Thank you very much, Stanley. Florence welcome. You just had something to add to that. Would you like to speak briefly to this before we invite the speakers to speak to the next set of questions?
Thank you, Mina. Can you hear me?
Yes.
Perfect.
Great, fine, thank you so much. Thank you. I'm sorry I missed much of this. I was at another meeting. I just joined as soon as I could. I like the notion of compliance. This the fact that we need to look at compliance a bit more positively. I totally agree. I think, however, that we should perhaps interrogate this notion of compliance. I remember the last time, which was a long time ago, I looked at data from South Africa, which is quite some time back, and do forgive me. I remember observing that there was a lot of monitoring happening, and monitoring in relation to what is happening in the ministries and the services and tick boxes. So I guess in some ways, what I'm suggesting is that as a group of people, as evaluators, we should perhaps interrogate the notion of compliance. What is it taking away from if compliance is at a particular level? And maybe we should nuance it more. So if we have compliance, what is missing and what are we complying? What is the compliance with? You know, is it just tick boxes, or what can we push? How far can we push this notion of, yes, something positive is happening, so let's get to the next level? So I totally agree that we should look at compliance perhaps a bit more positively and do more work on the side of the evaluation managers and evaluators themselves, and perhaps the commissioners, and push the notion of use of what we are finding in evaluation.
Mm-hmm.
You know, so what next? If compliance is happening here, what more can we do? That was what I thought about.
Thank you very much, and thank you, Dugan, also for putting that on the table and just prompting us to think about this from a slightly different perspective, and well, no, a significantly different perspective. Just to change to the next sort of round of questions, there's a couple of questions here that, and I've linked both the presentations, where the questions reflect on the extent to which the crisis or the impact of the crisis on learning, the impact of the crisis on the culture of using or not using problems for learning. And did you, particularly to start in relation to Stanley's presentation, did you see anything emerging from the crisis, perhaps more in a positive light, also in terms of stimulating the generation of innovating M&E methods as a result of the crisis? Stanley, if you could very briefly give us your thoughts on those questions.
Thanks, Minnie. Certainly, yes. It's just the pace of response on our part as M&E practitioners. Otherwise, the need for use of ICT more extensively is something that we have long seen as an area that is kind of a growth area for monitoring and evaluation. So the impact of this pandemic has actually compelled us to meet in this fashion, for example, to meet with clearly very busy people here, even Florence that I've just seen. Those are people you won't easily just have in a workshop. So this norm of online engagements, online meetings is one example of how we can actually, as M&E practitioners, capitalize on the fact that now it's the way how business is done, to even hold huge conferences, international workshops like we have here, and so on. That's the first part. And the second is linked to it. The talk of fourth industrial revolution and even fifth industrial is something that we've got to start thinking hard about in what it means for us. How do we then capitalize in its implications for the world of work and how things need to be done? For example, working from home, I'm sure 90% of us here, I'm just making a guesstimate, are working from home. And that has changed the world of work and how we see ourselves. And the need then for use of tools of the fourth industrial revolution and beyond is something M&E can do on the technology side. Then, of course, the debate around compliance, indeed, it's something that needs to be nuanced. I don't have to repeat the colleagues have said. That's my presentation was just showing that compliance under crisis is not something that is an option. You've got to tell people it's fire here, move to the side, but the extent to which then you engage with that and what it means for how we view ourselves going forward is very, very, very critical. The last point, of course, would be the whole value chain of learning from evidence, and even learning as in broader capacity development. We need to develop new methodologies quite fast, which could help us to reap the benefit of the high demand of evidence that the current environment has actually elevated. So there is a huge opportunity in that regard. Parliamentarians are really craving to be told about what's happening in communities, what big policy questions, what do we do about sustaining some of the socio-economic interventions? Are we accountable enough for the decisions that are made, and so on and so forth? And even the consequence management, there might be new tools that could be used to just make sure that the results of M&E actually are incentivized, the assumptions, and there are rewards for performance or non-performance. Thank you.
Thank you. Thank you very much, Stanley. May I kindly ask Dr. Mensah Brownpa, if you have any thoughts around the innovative methods and the impact of the crisis?
Yes. I think this in Ghana has been very, very crucial, and I think in many African countries. And as soon as the COVID issue came up, there were so many things which had not been observed or seen, which immediately popped up. One of it in Ghana, surprisingly, is it revealed how innovative these industrial sectors are. A lot of those factories producing, alcoholic drinks and others suddenly turned into producing sanitizers. And even beyond that, that is just industrial side. The whole work life of an ordinary Ghanaian changed totally. It changed in the way that there have been some of these attempts by some of these organizations to really give flexible time for their staff, and which has been opposed by the public system, to make sure that there is a wage, a register which marks the time that you come in and go out and all those things. And the emphasis in many of the public service organizations in Ghana has been presence instead of results. So I come and take that I'm at work, and then the next day and the next minute I'm at home. And then at the end of the month, I get my salary, not based upon the results. And this was quite revealing, that a lot of our public activities and work had been based upon your presence, whether you came or not. And then, as you said, just a matter of compliance, taking and going, without looking at the output and eventually the outcomes, how it affects development. So this is one crucial thing which came up. Another thing is also drawing our attention to the ICT technology, for which we have used, particularly in other sectors, in financial sectors, without extending it to the issues that are related to social communication, issues that are related to education, issues that are related to health, and other things. So it became obvious that in order for us to take advantage of this fourth industrial revolution, is to make sure that we organize ourselves in those other sectors, particularly health and education, to take advantage of this technology. Another thing which also came up, and I think is also revealing, is the way we are also providing skills and knowledge and ability for our youth. They seem to be quite knowledgeable when it comes to the issues related to the ICT and others than the adult. And therefore, if you look at the public service, there's a whole
Quand on regarde, par exemple, le service public, nous avons
simple use of Zoom became a challenge for many civil servants. Simple use of, even the email became a challenge for quite a number of people, because we are used to writing and having a courier transporting a letter from one ministry to another, rather than using the email, which has been long available for exchanges among public servants. So these are some of the things which I would say have been the new things, the new news that are coming out of these abnormal situations. It's revealing some of the challenges. It's coming up with some of the bringing up an innovative instinct among the Ghanaians, and then also eventually it's telling us that in moving forward, there are certain things that we need to pick up. It's also telling us that learning is very important, because we're now building in the small and little lessons that others have been able to document and review, and using it to upscale it, to bring it up to the national level. So if an institution has been managing its work style in this way, which has been quite useful for the COVID time period, then the lessons from that now becomes scaled up, and then it's used in the ministries and others. Education for few private schools that have been using the ICT technology, now it's become pertinent that we need to scale up. So we build on what they have learned, what they think are the constraints and those areas, so that it's not...
informatiques se sont développées davantage ça, c'est juste quelque chose, certaines choses que nous pouvons souligner au niveau minime, au niveau national, au niveau large. Donc,
real and have an established formal learning process, which would rather help us in the upscaling rather than building up additional constraints. So that is it.
Thank you very much. May I invite somebody from the audience, if they have any thoughts either on issues related to culture and use, as well as issues related to the impact of the crisis on M&E and how we undertake our M&E. But before I do that, I'm going to ask Kara, who was a presenter, to maybe speak to her comment. Kara, you're not allowed to hide in the chat, I'm afraid.
Fair enough. Yeah, I mean, I was thinking about the way that M&E is thought of within government, and Stanley's comment about people being seen as the policers of the public sector. And I'm wondering, things are moving so fast and changing so rapidly. I mean, even in South Africa, we have seen changes to lockdown regulations and all that sort of thing as a result of this kind of rapid learning and feedback and that multi-stakeholder dialogue. But I'm wondering if one of Stanley's points around, you know, how do we use all of this crazy time to change the public sector and to do long-term policy around pandemics, and I guess climate change is coming. There's going to be, well, it's here, but you know, there's going to be other crises that the government needs to respond to in a similar way. Who is responsible for some sort of holistic view of learning? Or you know, is education going to learn one thing and health learn another, and then the NDPC over there will learn one thing? And how do we kind of get a comprehensive overview of all the different things that have happened so that we can action it and do better next time, or build a more resilient system, perhaps, if that's what we want to be thinking about. Yeah.
Great question.
Yeah, well, thank you. Thanks, Kara. Ian, can I invite you maybe to give your thoughts, because you also raised the question around, and I think they are linked, around evaluation criteria, and how might we adjust, how might we shift our policies and our practices to be better prepared to anticipate crisis. Absolutely, Dugan, I don't think anyone's ready for the next pandemic, but we certainly do need to be able to anticipate new crisis or increasing unpredictability. And how might we adjust and adapt, drawing on some of the lessons that we are learning in this one?
Sure. I mean, I think it's a really important question, because I think we're heading for 30, 40 years of continual crises. I think between the fact of biodiversity, what we're doing to our biodiversity, what's happening with climate change, etc., and the consequences of inequality which are being enhanced by the pandemic, etc., I think we're really heading for difficult times.
Aura un avantage impact sur la culture gouvernementale. Donc, je pense que nous aurons à nous poser les questions sur
Tools and our systems start to become more adaptive, start to become more both using real-time data, but bringing in continual reflection, because a 5-year plan is going to be out of date pretty quickly. So I think it's going to be, there's really going to be questions in how we help government and, you know, at other institutions as well, to be able to become more agile. Because anything else, you're going to be stranded while the sea engulfs you. You know what I mean? We've got to find ways to move, and I think Kara's question about how are we reflecting and learning from the current pandemic and the crisis is a very important one. So rather than saying this was an isolated example, this is going to become the norm. So how are we going to be able to cope and manage during that?
Thank you very much. I think this is perhaps a really good point for me to hand over to the chair, and to perhaps invite our respondents to give their reflections to some fairly, I think, challenging and hard-hitting points. So thank you, and over to you, Chair.
Thank you very much. Thank you very much. We've had a very good and a very fruitful discussion. It's telling us, are we ready for the next one? Whether we like it or not, we should be ready. And then Kara is asking us, who is documenting? And who is documenting all these lessons and be leading in a process where we can put it together to face the next thing which comes up. And Jan is telling us that, well, this is a trend which has been going on for, we have issue of climate change, inequality, diversity, and now we're having these physical health challenges. In all these, in the past, where are the lessons? And then going into the new ones, where, how are we coming into the present one? What are we doing now in terms of documenting and responding to current issue? And then we move on to how do you respond to it in the coming future? These are things that, thank you very much, Stanley, and thank you very much, Mine, for getting us through this. So we go to the next one, who are also great contributors to this process and the burden of this culture in Benin. Once I mention Benin, it reminds me, and welcome to the South African ambassador to Benin, who is also with us on this platform. You're very, very much welcome, Your Excellency. So we go to Benin and we're going to listen to Abdullah and Damasi, and this is just for 5 minutes. So quite brief on what are the lessons that we're also going to pick from there with respect to MAE culture in the public service. Is it just mere compliance?
Thank you, Chair, for the question and giving opportunity to Benin to share our experience. Can you hear me?
Yeah, you're on, Damasi. We can see you.
Thank you. So in Benin, we have established a MNE culture as we start putting MNE system in place in 2007. And that was in the mandate of the government. So there is a ministry in charge of evaluation. So we design a national evaluation policy, and in each department we have a directorate in charge of MNE that produce frequently MNE reports and share the report with the decision maker, and they pick those evidence to reflect on the policy they are implementing. And we used to do a great exercise in Benin, and we used all the evaluations that have been conducted, and we see how the evidence that are generated from the evaluation are used in terms of policy change. So we have seen that there's more effort in terms of the use of evidence, because when they conduct evaluation, the department used to take into account this evaluation recommendation and to take action. So some action implies change in the policy. Those implies change in the institutional framework and the way the process of implementation policy or project is being covered. And we have seen that there's more process use of the evidence. So we see that evidence that are generated is used in terms of developing new policies and programs. But there's still many things to do, as our aim is to involve all the DGs of the policy manager, policy makers to be aware of the importance of the evidence. Because if in each department, the minister knows that before proposing a policy to the government, he needs evidence, this implied a culture in the system. And also, we are providing support to that, because we have an evaluation database that shows all the evaluation that we have conducted. We have all the recommendation, and there is a MNE platform on this database that shows how the recommendations are implemented. And also giving access to all the sector to those, this database, give them a sense of what evidence exists in the sector and how it can be used to shape a new policy. In terms of capacity building, if I go back to the framework of the book, we used to train the deputy ministers and also the DGs in terms of the importance of the use of evidence. And we are going to do the same thing with the MPs in the coming months to help them to get a sense of the importance of the evidence to oversee the government action. And we provide guidance. There is an evaluation guideline that we have been present to the Board of Ministers. And with this guideline, all the ministers need to have a theory of change of the program and policies before they get funding for the government. And in each ministry, they need to provide ex-ante evaluation of the projects before it gets involved in the back of the project of the government. And also in each project, they need to find a line to finance or to fund the evaluation. So there will not be, after the implementation of the project, you search for funding for the evaluation. Each project need to program this funding line in the compact of the project. So all these things are going as they can in our country, and they have more challenges because in terms of the awareness, in terms of the capacity building, there's still challenges, but we are working in the champion side as we are involving the DGs and the MPs, such that this will give a change in the system. When I link this M&E to the crisis, we developed a new methodology in line with 20 Mbele program, that is the rapid evaluation methodology. And in this instance, we need to use more ICT to collect the data, and also it gives us less time to produce the evidence. So this change in the environment of M&E due to the crisis also is shaping the way we are providing evidence in our country. And the government is doing very well in this issue because all the decisions that are made in terms of locking down or restriction in terms of COVID are evidence-based due to the progress in the growth of the infection or in the growth of the death. So each week or each month, there is a change in the decision of the government that is linked to the evidence that is produced in terms of the data that are collected around. So this is the main issue I want to raise in the case of Benin. Thank you.
Thank you very much, Damase, and this is the wonderful thing. I'm sure we're all thinking through our heads this culture of M&E. This has been the challenge for many countries because we talk about institutional framework. You shared with us the policy, the culture of looking for evidence and looking for results, the question of using it as a basis for planning, doing an ex-ante process before we even have a policy approved. He's also brought us to the challenge of skills and capacity, the conscious effort to build the skills and capacity of many deputy ministers so that they can use this information and crave for evidence in policy making. And one of the biggest challenges that is brought to us, and which is very valid in my country too, where you have government changing their appreciation of M&E. At any time there's a new government, they have their own different perception and understanding of M&E, could go down or up. And therefore you need to do rapid evaluation to bring results for government to use in the process of the 4 years electoral process. So this is a crucial thing. The use of technology is required if you want to do a rapid collection of data, rapid analysis and all this. So we thank you very much, Damase, for this very, very intriguing also sharing case, which is the case of Benin. And it runs across many countries, many countries in Africa. Thanks. So we're also going to, Damase, let me say that is a senior evaluation officer at the Office of the President in Benin. So I must indicate that so that we can put our whole appreciation to in perspective. And this is a very good work over there. If I look at my country and what we're doing, this is far from it now. And we hope that this will serve as a learning process for us, even in Ghana. Great. I'm looking at the questions, and it's brought up a very crucial suggestion that the next webinar should be looking at an MAE in the prison, the COVID-19 prison. I think that's a very interesting topic which somebody has proposed here. And there's so much appreciation for this work. We go to the next one, which is coming from David. And this is also looking at, for all this in the planning perspective, how do we respond and what can we do? So we know that these are very important things we need to do in order to enhance MAE, the evidence and its culture in many of our undertakings. But what do we do for the planning perspective in order to attain this? So we go to David Keyboard in another 5 minutes. Just give us, looking at this whole discussion from a planning perspective. David, are you there?
Yes, thank you. Thank you very much. Thank you very much, Chair. I want to say that this discussion has been very interesting, a very big learning experience for all of us who are M&D practitioners. I think COVID has brought the challenge that we really need to move very fast with the way we make our decisions, because the world is ever changing, and decisions, then the learning process has to be made on the move. So, but the COVID has found us we are not prepared, or we have not been prepared to be able to move quickly, especially on areas where we don't have a lot of information, and that's where the challenge lies. And Ian has made it very clear that there will be very many other challenges that we are going to face, and therefore our strategic plans are going to be running out of date very quickly. And therefore, it calls for us who are involved in planning to have then robust and agile plans that can be adjusted very quickly, that have a very good risk analysis and risk assessment, and we can be able to change with when need arises. It is also telling us that that our M&D then has to be fit for purpose. We cannot continue, based on what we have seen during this COVID time, to have the M&D systems that we have in our countries. We need to relook at our M&D systems, look how do we retool it to be able to run quickly evaluations that are required for quick decision making. I think this pandemic got a lot of M&D practitioners, especially in governments, where the appetite for risk is very low, caught us on a bad footing, because for us to undertake any evaluation, any learning process is a very long process, and at times we are not equipped with the right skilled workforce, with the right tools to be able for us to undertake this. And therefore, it brings in the challenge of how do we reinvent our planning process. Kenya, when COVID came, and as we were looking at our Kenya at our medium-term plan, and noting that there will be significant changes in how the plan will roll out, we decided to do an economic recovery strategy but it was faced with a lot of challenges because we did not have the right data, because the data collection was a bit hard to get, or we did not have the right frames to be able to collect data, and therefore developing that tool becomes quite difficult. So we need to relook at our M&D processes and see if it is fit for purpose. We also need to develop new tools, and I think the issue of technology has come up. This is a plus that we can be able to leverage on it. But one of the other challenges that we find in our planning processes is that we still have challenges in the use of evidence, and the challenge of use is also coupled with the issue of demand. Did we have our political class? Did we have our leaders demanding for M&D that could lead the discussion on M&D? And this demand, from where I sit, has been very low. A lot of the decisions that have been made based on lack of evidence. And this is something that we need to bring in, especially the political class, the top leadership, to rely more on evidence that that we are going to have. I like what Stanley said, the beginning of how do we work on the ecosystem, on the M&E ecosystem, not only locally, but also networking with other practitioners in other countries to be able to learn quickly on how these things can be done. And I wanted to borrow from the example of how the COVID vaccines have been developed. The global practitioners can coalesce all their knowledge in one thing to be able to develop something that is required. And therefore, as M&D practitioners, we can be able to work and build on this strong ecosystem so that we can be able to share from other jurisdictions what they're doing for us to quickly and rapidly undertake evaluations that will be used. We also need to work on how do we use what has been talked a lot about compliance to just ticking the box, and then translating that into useful data. And I think we just don't need to stop at the compliance area, which is mostly about monitoring, but how do we deal with the compliance to be able to escalate it to be useful data that can be used during periods like when we have a pandemic, to be able to undertake modeling with that data. The issue of culture, in terms of how we do our normal planning, it's something that we have to move through. And I think with the issue of retooling our monitoring and evaluation, with the issue of escalating then the demand from our leaders with practical solutions, it will be able to make our planning be more robust. We need to look at the way we do long-term planning and be able to look at if we can do it in slightly shorter circles that basically join the dots. Otherwise, 5 years plan without breaking it down into shorter, medium-term plans, then we always create knee-jerk reaction when we have situations like this. And they're going to be, as Ian put it, they're going to be very many of this type. So what I can say is, one, we need to build up, as I close on the evaluation ecosystem, reinventing the wheels, then building up our demand.
Thank you. Thank you very much, David. Thank you very much. It's quite another revelation, and there's the need for us to have quite a robust and agile plans. I like that, and it has been so obvious within the COVID time because people are now looking at almost all the plans are becoming extinct even before they are completed, because they need to be reviewed massively. How do we do that if the planning term has not come to an end? So these are all experiences that we need to take up. One thing I'm taking from him is also the opportunities that has been reviewed also in terms of the importance of M&E, and then moving it beyond from the compliance level to real results and using these results in our planning. So that cyclical relationship is becoming more evident and vivid during this time. Again, it's also bringing up the same issue of how quick we could employ our tools and go through these cycles so that it becomes relevant to those who are making the decisions at the time that we're facing this pandemic, and if we might face one in our lifetime, that will know how to go about it in a better way. So these are some of the things which are coming up. It also comes back to the very question I think Kara asked: how do we document this? How do we pick these learning issues? How do we share across? And how do we as practitioners use it to build on the tools that we already have? And in a very quick manner, respond to some of these things which are coming up. So thank you very much, David. I think that I saw 37 to 40 people. We're now 23, so it's telling us that we have to bring our conversation to a very good end. But I think that if we should carry on, even for 3 hours, we still have very cogent things and very important things to talk about. And that's what I'm seeing here. But it's bringing us to the core issues of, is compliance enough? No. And I'm sure every leader in Africa now knows that we need to build that culture of learning to follow evidence, results. And it is only when you use these results in planning that it becomes relevant and not just being compliant to the plan. The other thing which is also coming up, and I think we should have to take it up, is to identify some of the opportunities that are existing in our various countries and experiences, and what are the challenges. And going forward, as we share this, how do we respond to it and learn from that? I think it's also very, very crucial. And it also brings up the issue of innovation, as Mine brought up. A lot of these things are going on. Who is recording? Who is documenting? And how do we bring that and relate and share and compare as a team? I think these are things that we need to take up. In the public service, there are crucial things that are happening in almost every country's public service, shaping it in terms of the institutional style, in terms of even the things that we used to do, in regular things that we used to do in the public service, in terms of attitudes and values, and all these things are changing just because of this COVID, and the way we do our things is being changed. But then the question again is, how is this being recorded from country to country? Who is doing it? And how do we have the opportunity to share and compare? I think these are crucial things that we as a group we need to look at. And I know that Twinde should be able to create the opportunity for us to continue with this. Okay. With that, if there's any crucial word, then I think we'll thank ourselves for the good thing. The number has reduced to 20, and I don't want it to go further. So we thank you very, very much for the opportunity, Jan and Kara and co who worked on this, and all the people who have contributed, the writers to read, David and Damasa and co. It's certainly very, very revealing, learning opportunity for us as individuals, and we're going to carry it on our various platforms and country. And I'm sure that the next time we meet, we'll be in a better situation to tell our story and be able to identify how we're going to document it, the lessons, and how we're going to use these results. Thank you very much. And I see the feedback is all interesting, and everyone. Thank you.